Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the histology of the epithelial tissue. The epithelial tissue or epithelium consists of sheets of aggregated polyhedral cells. So we are getting polyhedral cells. They are in a sheet and with small amount of extracellular matrix in between them. An epithelial cell rests on the basal lamina. This is the basal lamina here. This is the basal lamina that separates the epithelial cell from the underlying connective tissue. Epithelial cells covers the external surface of the body just like the skin. The stratified squamous epithelium so lines the internal cavity of the body like that of the peritoneal cavity lined by the mesothelium or the pleural cavity lined by the pleura, the visceral pleura, the parietal pleura lined by mesothelium. That is a type of simple squamous epithelium. It forms various organs and glands and line their ducts, various organs like that of the liver. Liver composed of glandular epithelial cell, those are the hepatocyte. We have also the epithelium in the nephron that forms the unit of the kidney. It forms the glands like that of the parotid gland, the sublingual gland, the submandibular gland that contains the glandular epithelium. Today in our discussion, we'll give more emphasis on the surface epithelium. So if you look at the surface epithelium, we'll get the simple epithelium, stratified epithelium. Simple epithelium are one layer of cell. Stratified epithelium are multi-layered cell. Simple epithelium, depending on the shape of the cell and size of the cell, it is flat cell, just like the scale of the fish, okay, very much flattened cell, simple squamous epithelium. Then we'll get the cuboidal shape like a cube. There is simple cuboidal epithelium. Like a column, we'll get simple columnar epithelium, and we'll get the pseudostratified ciliated columnar epithelium. These are the cilia. These are cellular modification. Pseudostratified because they are actually one cell layer, but cell size is different. Nucleus is located in different places, different levels. So it seems to be multi-layered, but this is a one layer epithelium. Not necessarily all cells will reach the surface. Some cells are basal cell. They are remaining close to the base. So all the cells are connected to the basal lamina. Cells are different size and shape. So it is called pseudostratified ciliated. These are the cilia, columnar epithelium. This is a stratified epithelium, stratified squamous epithelium here. Like in the vagina, we'll get the stratified squamous epithelium. We'll get keratinized stratified squamous epithelium. We may get in the skin, that is the stratified squamous epithelium. Okay, we have the stratified cuboidal epithelium, stratified columnar epithelium. In the gland duct, we'll get this. Transition epithelium is present in the urinary bladder, in the ureter, in the renal pelvis. It is also called urothelium. So this is the classification of the epithelium. Simple, stratified. According to the size and shape, squamous, cuboidal, columnar, pseudostratified columnar, stratified squamous, keratinized stratified squamous. There is some keratin, some dead cell here. And we have the stratified columnar, stratified cuboidal, transition epithelium present in the urinary system. Okay, so if we go there, we'll get the epithelial types of epithelium according to the layer. It is simple one layer epithelium. one layer. This is actually connective tissue, and epithelium rests on the basement membrane or basal lamina. Okay, so we got that. So this is the basal lamina, okay, underlying that separates the epithelium from the underlying connective tissue. This is the basal lamina here. Okay, pseudostratified columnar epithelium. This is simple epithelium, but it looks like multi-layered because of different size and shape of the epithelium. They have cilia, so it is called pseudostratified ciliated columnar epithelium. There is a surface modification. Cilia is present here. They sweep the dust. Okay. We have multi-layered epithelium. We have gone through that part. According to the shape, we have the squamous, cuboidal, columnar epithelium. Okay. Classification of the epithelium. Simple squamous epithelium. Okay. We have to find out where it is present in the blood vessel, lumen of the blood vessel. In the tunica intima, we have the endothelium. These are simple squamous epithelium. This is the epithelium here. This is the underlying connective tissue. This is a basal lamina here. Okay. And also found in the Bowman's capsule of the kidney, in the respiratory spaces, in the lung. This is that it lines the alveoli of the lung, that exchange in gaseous exchange between oxygen and carbon dioxide from hemoglobin of the RBC to the air, exchange barrier in central nervous system, will get the simple squamous epithelium. Okay, exchange and lubrication, that is the function of the simple squamous epithelium. Simple cuboidal epithelium will get that in small duct of exocrine gland, okay, like that of the parotid gland. Surface of the ovary, that is the germinal epithelium, will get the simple cuboidal epithelium. In the kidney tubule, in the thyroid follicle. Thyroid follicle will get simple cuboidal epithelium if the person is in euthyroid condition. Person is in hyperthyroid condition, then will get columnar epithelium. If the patient is in hypothyroid condition, then we'll get simple squamous epithelium. This is found in the euthyroid or normal thyroid functioning thyroid follicle. Function, absorption and conduit, barrier, absorption and secretion. Okay. Simple columnar, they look like columns, okay, very tall. Okay, small intestine, colon, stomach lining, and gastric gland, and on the line on the luminal surface of the gallbladder. Function, absorption and secretion. Secretion and absorption. Okay. So pseudostratified we just discussed where it is present. It is present in the bronchial tree. We'll get the pseudostratified in the trachea, in the bronchi, and the primary bronchi, secondary bronchi, up to tertiary bronchi. We'll definitely get the pseudostratified ciliated columnar epithelium. Then its height gradually decreases. Function, secretion, conduit, absorption, secretion, because we have some goblet cell that secretes mucus. Here we have some D and ES cell that releases some type of neuroendocrine substances. Okay, so we have multiple type of cell present here, like this goblet cell. Also D and ES cell, diffuse neuroendocrine cell. Stratified squamous epithelium that is found in the oral cavity, esophagus, and vagina. Okay, there is no keratin here in the oral cavity. Okay, so in the oral cavity, on the tongue surface, in certain places, it may have some keratin at the tip of the filiform papillae. Otherwise, under surface of the tongue, it is simple. It is stratified squamous and without any type of keratin. Stratified cuboidal epithelium found in the sweat gland ducts, large ducts of exocrine gland, and junction between the anus and the rectum. Okay, so stratified columnar epithelium found again in exocrine gland, an aneurysmal junction, barrier and conduit, Transitional epithelium found in the renal papilla, minor calyx, major calyx, renal pelvis, ureter, urinary bladder, and up to the prostatic part of male urethra. Okay, we got the lining epithelium where we'll get the transitional epithelium. We'll go to the intercellular junction. There is junction between two epithelial cells, like that of tight junction. There is called jonulo-occludens here. Tight junction that regulates the flow of fluid between the cell. Adherens junction, also called jonular adherens here, and we have some actin filament here. Okay, then we'll get desmosome or macula adherens. We'll get intermediate filament here. Okay, we have the gap junction here. Gap junction, through a gap junction, ion may transfer from one epithelial cell to another epithelial cell, from this side to that side. Ionic transfer from that side to this side through the gap junction. Hemidesmosome means half desmosome that anchors the basal surface of the epithelium to the basal lamina here. This is half the desmosome. This is an anchoring purpose like that of the desmosome and the adherens junction. Here, half of the desmosome connects the basal part of the epithelium to the basal lamina. Okay, so we have to have some fact about epithelium. They are avascular. So how they get their nutrition? They get their nutrition from the they get their nutrition from the underlying connective tissue by means of diffusion, but they are avascular. There is no direct blood supply to the epithelial tissue. Okay. So what are the highlight epithelial tissue? These are polyhedral cell with minimum intercellular matrix. Characteristic, they are avascular and they get nutrition from the underlying tissue. They actually protect the the surface, and also they may have one another variety called glandular epithelium, forms the glands of the body. Surface epithelium has protection, secretion function, location, location according to the type of the epithelium. Simple squamous epithelium located on the mesothelium, located on the lung alveoli, on the endothelium of the blood vessel. We have the classification. It may be stratified squamous, stratified cuboidal, or it may be simple squamous, simple cuboidal, or simple columnar, depending on the size, shape, and layers. Surface modification, we have cilia mainly that sweep the dust in the respiratory system. Also, cilia is present in the fallopian tube. Okay, cilia, we have the stereocilia that is present in the vas deferens and the epididymis. These are long microvilli with some type of branching sometimes, and their main purpose is absorption. Okay, and we found that the cilia, the stereocilia, okay, and microvilli. These are very small extension from the surface. Okay, the microvilli. We found that microvilli. Okay, these are the microvilli. These microvilli are associated with absorptive function. Okay, we got that. Now, if we go there, okay. Now, junctional complex, some fact about that, they are avascular. They may derive from ectoderm, mesoderm, and endoderm. But remember that we have some terminology, metaplasia, conversion of one type of epithelial cell into another type of epithelial cell. Okay, that may be the harbinger to develop a cancer, but it is reversible. So, suppose a smoker epithelium in the bronchi may become simple squamous due to irritation by the smoking. But if he stops smoking, it may revert back to the normal epithelium of the bronchus, like that of pseudostratified columnar epithelium. Okay. Carcinoma is a cancer of the epithelium. Adenoma, benign tumor of the gland of the epithelium. Adenocarcinoma, that is the cancer of the glandular epithelium. Okay, we got that. Now we have gone through the surface modification. What is that? Cilia, stereocilia. Okay, so these are the under microvilli are the surface modification. Intercellular junction, we have the gap junction, we have the macula adherens, we have the zonula adherens, or we have the we have the tight junction or zonulo-occludens. These are the intercellular junction. At the base of the cell, we have the hemidesmosome that connects the base of the cell to the basal lamina. We got some facts about the epithelium. It is avascular, clinical application, metaplasia, and also the adenoma, adenocarcinoma. Okay.